Of course, patients care about understanding exactly what's wrong with them. That's simple common sense, simple psychology.
In this era of information, patients absolutely care what's wrong with them. In fact, they've often consulted Dr. Google before they present and have some idea of what they think is wrong with them.
If you look up in Google, receives about 1 billion health-related questions every day. And there has been a recent publication in International Urogynecology Journal by Gonzalez et al. And they investigated what is the communication on OAB-specific issues in social media. And there's a lot of communication traffic. So obviously, patients seems to be highly interested in those things. But the question is, do patients always express this interest in front of their doctor? Unfortunately, the list of important topics or issues related to the health problem is only partly matching between the patient's list and the doctor's list. So there again, it's a communication issue. And of course, urodynamics can help to answer some of those questions and correct or verify some of the pre-information that the patients get from the internet nowadays.
Well, in our current information environment with so much available online, I believe patients are actually more sophisticated than ever in seeking knowledge about their conditions. This is really an exceptional advance in medicine as it engages patients in their own treatments and recovery. The levels of health literacy are actually increasing. Urodynamics are a very fundamental feedback tool that you can utilize to help counsel patients through both the diagnoses and then expectations for treatment.
Perhaps part of the problem is that the healthcare professionals fail to explain properly the potential benefits of proceeding with the test, meaning fail to explain that the test has the best chance of really understanding the mechanism of the problem, but also the potential complications that could result from proceeding with treatment.
Yes, they want to understand perfectly, if possible, their condition and the underlying pathophysiology. If we imagine a man undergoing surgery for benign prostatic obstruction, knowing that his condition is also related to the trousseau underactivity, for instance, may let us understand that the results after surgery may be a little bit less good than in patients purely obstructed without any problems of their detrusor. So understanding this pre-surgical situation help the patient to better accept also the problems that they come after surgery. For instance, patients with the trousseau activity often have increased frequency and urgency also after surgery for a period of time, but they already know it before surgery after a urodynamic test.
And the Upstreet trial has presented some qualitative data on just how much patients value urodynamics or what it gives them in terms of being definitive on their potential cause or cause for their lower urinary tract symptoms.
And when they balance the information given with the urodynamic testing against the extent of discomfort, they are very clear that that extra information is hugely important in their perception. They want the doctor to have full information so that the doctor can make a suitable recommendation for the individual. Patients are all in favor of that, as we have published from our upstream results.
Yes, absolutely, they do care. Our patients usually would like to hear from their physicians the exact pathophysiology of their condition, the available treatment options, their success rates and the possibilities of failure and the predictors of failure. In contrary, when they are not informed about these parameters and facts, it can be the subject of a medical legal issue, especially when things go wrong.
I think it is also very much important that patients understand what is really wrong in the lower urinary tract, because that can influence the motivation on different therapies. For instance, pelvic floor physiotherapy. I think it is very difficult to prescribe someone pelvic floor physiotherapy if he doesn't understand for what he is doing it. So I think here really explanation and knowing what's going on is very important. And maybe that is a reason why antimuscarinics, although studies show that they are so perfectly working, not many people seem to adhere to that therapy. And there's a high number of people that stop this treatment, maybe because they just don't know why they take it.
It is interesting to see that patients prefer to be studied with the urodynamics. If we ask them, do you want to be treated empirically or after a proper urodynamic evaluation? The majority of the patients prefer to be studied more in depth and to be treated after a urodynamic investigation. This is a finding that is coming from UK and from Italy. And in both these studies, patients had a clear preference for the urodynamic investigation. And also the satisfaction after the treatment, at least in the Italian study, was higher for patients treated according to the urodynamic evaluation in comparison to those treated according to only the first-line evaluation.